Chairman, I can confirm we're now live.
Thank you very much indeed. And good afternoon, everyone. It's a pleasure to welcome you to this Bracknell Forest Local Outbreak Engagement Board. And it's good to see you here this afternoon. And welcome. So we'll move straight on to agenda item 1, which is apologies for absence. Please, Kirstine.
Chair, I've received apologies from Councillor Brunel Walker, Charlotte Pavitt, Abby Thomas, Philip Bell, Fiona Slevin-Brown, Sophie Gardner and Andrew Hunter. Although obviously sometimes there are difficulties in joining meetings digitally, so any members of the board who have not provided apologies and are unable to attend, I will record apologies for.
Thank you very much indeed, Kirstine. Thank you. Members of the board, please turn on your microphone and confirm that you're present when Kirstine calls your name. And as Kirstine said, anyone who doesn't respond will be recorded as having given apology. So, Kirstine, back to you, please.
Thank you, Chair. Councillor Dr. Barnard.
Present.
Councillor Bettison.
Present.
Councillor Birch.
Present.
Kelly Williams.
Present.
Elena Rozelle.
Present.
Timothy Whedon.
Present.
Is there anyone else present whose name I've not called?
Yeah. Councillor Mrs. Dorothy Hayes.
Thank you, Councillor Hayes.
Sabrina Kwa.
Sabrina, you're deputising for Charlotte Pavitt, I understand.
Correct.
Thank you, Sabrina. Is there anybody else present whose name I've not called? Thank you, Chair.
Thank you very much. Thank you. Right, we move on to agenda item 2, which is declarations of interest. The full text for declarations of interest is set out on the agenda at item 2. If any member has a disclosable pecuniary interest or an affected interest to declare, please indicate in the meeting's chat and I'll come to you in turn. I don't see anything, in which case there are none to declare at the moment, but I would ask the usual caveat that should any conversation or debate take an unexpected turn, please don't hesitate to declare an interest at any time in the meeting if one should arise. Agenda item 3, the next item on the agenda is the consideration of any urgent items. Are there any, Kirstine?
No, Chair, I'm not aware of any.
Fine, thank you. Then the next agenda item, item 4, is to review the current data that relates to the levels of COVID-19 infection rates nationally and within our borough. Over to you, Sabrina.
Thank you very much.
We've got it.
Just make it full screen. So currently in the last 7 days, that will be the 15th to the 21st of April is our most recent data. Our current rate per 100,000 is 13.9. This is an almost 60% decrease compared to last week. For our rate for those aged 60 and over, that's down to 4.1. So the numbers and the rates are very low at the moment. Looking at rates per by age group, as you can see, due to vaccination, from 65 over, we have very low rates, and those can all be, you see they're all coloured in yellow. We do have one case in someone aged between 70 to 74, so that's coming up as that green box there. When we look at younger age groups, it's mostly lighter coloured green, aside from a cluster of cases, so about 5 or 6 cases in those aged between 35 to 39, and that's what can be seen here in the middle. But at ward level, the numbers are very small, but we are seeing that over on the left-hand side of the borough, which is commonly what comes up as having slightly more cases. There are more numbers, but we are talking about 5 to 10 cases per ward. Deaths, we've seen a significant decrease. There are currently no COVID-19 deaths in the most recent week recorded, and there, as you can see here, there's just 3 non-COVID-19 deaths. We're much lower than the 5-year average for the past 5 years, which is represented by the green line going across. As for vaccinations, so in Bracknell Forest, we've had a total of nearly 55,000 dose 1 vaccinations, and the coverage for those aged 16 and over is 52%, very similar to the England level of 53%. Thank you very much.
Thanks, Sabrina. Thank you. That's very, very good. If any board members have any questions, can you please indicate now? No questions? No, in which case, thanks very much indeed, Sabrina. Thank you for that. The next agenda item, item 5, is a communications and engagement update at both national and local level. Over to you, Elena.
Thank you, Chair. Just bear with me while I share my screen.
We've got it.
Yeah, just make it bigger for you, 2 seconds. Okay, so over the past couple of weeks, and probably for the next couple of weeks, our communications priorities have remained pretty static. We've really been focusing on testing and vaccination, so we've been continuing to promote how to get tested, including the rollout of Pharmacy Collect and why it's important. And we've also continued to promote who is eligible to be vaccinated, including the age group. So just today, it's been reduced down to over 42s. So as soon as we get that information, we get it out to the community. And we've also been making sure that we let people know how many people in the borough have been vaccinated. And we've been myth busting as well, because that all encourages take up and behaviour change. We've interspersed hands, face, space, isolate and ventilate messages into those messages too, just so that people know how to keep themselves safe and to stop that chain of transmission. Another focus for us has been the increased promotion of self-isolation, so that people know what they have to do and when, and that they might actually have to be asked to do so at short notice, and what preparation they might need to take now, just in case they do have to self-isolate. We have looked at a couple of marketing opportunities to encourage that understanding, and we're just about to start rolling those out to support the key messages in the next couple of days, and they include outdoors and out of home advertising and marketing opportunities. The roadmap step 2 has been an important priority for us over the past couple of weeks, and continuing on it will be for when we get to step 3 on May the 17th, just making sure people understand what they can and can't do, and actually how to shop safely, dine outdoors safely, and go to leisure facilities safely. And we've been working closely with our partners on those messages as well, for example, the lexicon. We've added into that people must still follow the rules if they have been vaccinated, just to stop the chain of transmission, because that was something we were hearing anecdotally wasn't particularly clear. So we've just ramped up some of those messages as well. Sadly, we had the death of His Royal Highness Prince Philip on April the 9th. So we had to do some publicity around keeping people safe when they wanted to pay their respects, and to avoid travel to Windsor. So for about a week, that was a real focus for us. Translation and interpretation, we're just in the process of updating and adding extra resources to our online webpage around different languages, around different ways people can get information if they have a disability. And we're looking to get those out via our community engagement team to some harder to reach and niche audiences over the next couple of weeks as well. And then finally, our last focus has been around mental health, so that we know that with the pandemic, it isn't just a physical health crisis for people, it's actually a mental health crisis for people as well, and supporting people in the borough to understand where they can get help. We've been working very closely with our CCG colleagues on promoting that information, and a 4-page section in Town and Country that's just in distribution now was added to that because we felt it was really important. And we're planning for Mental Health Awareness Week in May, which will also be a focus for us around COVID and what support is available locally. That's it from me. Happy to take any questions.
Thank you very much indeed, Elena. Thank you. Colleagues on the board, do you have any questions for Elena? Yes, Councillor Dr. Barnard.
Thank you very much, Elena. Really comprehensive and a lot of good messaging going out. My question is, with the increasingly good weather and the extremely understandable fact that our young people like congregating in larger groups, and knowing that this was clearly a potential transmission risk, but understanding they're outside, what messaging are we going to sort of try work with people about over the next few months? Not to stop them having fun, but just to remind them that there is the potential of transmission. And we know that from time to time we see this come into schools. So,
yep. So we will continue to support that with our schools. We've got a really excellent link in through Debbie Smith in our schools team, who helps us get the message out to young people directly through schools bulletins, school head teachers, that kind of thing. We've also got a really good link in with the youth service, who've been really excellent in supporting our key messages over the past year. So we will use those avenues as well. And I think it's not just young people at school. I think we need to target the sort of older, younger people as well.
Yes, I know what you mean.
We'll also be using the parks, etc.
Yeah, no, it's not to demonise young people or anything. It's just to say, you know what I mean? It's that sort of balance, isn't it? You say the older, younger people as well. Great. The small groups are there to try and just still provide some mutual protection, given, of course, we're talking about the portion of the population that have not yet been vaccinated.
Absolutely, and they will be a focus for us as we go through. Yeah.
Yeah. Thank you very much, Elena. Thank you.
Thank you, Elena. Thank you, Councillor Barnard. Any other questions for Elena? No, then Elena, thank you very much indeed for your time and contribution. Thank you. Agenda item 6 is public participation. Kirstine, do we have any questions from the public?
Chair, I'm not aware of any questions that have been submitted to the committee Dropbox in advance of the meeting.
Okay, fine. Thank you very much indeed. In which case we move on then to the final item on the agenda. Agenda item 7 is to review by exception the ongoing action log for the local outbreak engagement board and to agree a revised meeting schedule. Do we have any anything to discuss by exception? If there's nothing that anyone wishes to raise, then I would just like to remind colleagues on the board that if they should, in their own time, discover any false or fake news about the pandemic, we have an ongoing plea, please, to refer that fake news to the board so that it can be addressed and countered with accurate information. And we're also on the lookout for anyone who has contact details of anyone who would be willing to share their COVID-19 story as a case study about how COVID-19 has affected them. And if you have any ideas for that, if you'd please share those ideas with Elena, because she's on the lookout for people who are willing to share their COVID-19 experiences. With that, that takes us on to the date of the next meeting. And the next scheduled meeting of the board is Tuesday, the 11th of May. And that just a warning, please, that is brought forward 1 week from the originally set date of the 18th of May. The reason why it's been brought forward is so that we can be briefed in advance about what is going to be changing the following week on the roadway to normality, we hope. So with that in mind, I'd like to thank everyone for their participation in the board today. I see Councillor Dr. Barnard's hand is up.
I have seen it's a historic hand. I will lower. It's
a historic hand. It could be interpreted as an early wave.
Yeah. Apparently you can do that, but I wouldn't know how.
In which case, though, I would like to thank everybody for their attendance this afternoon. And I look forward to seeing you all on the 11th of May, if not before. And in the meantime, please keep safe and well. Thank you, everyone.
Councillor Bettison, can I just say to Elena, it's Councillor Hayes here, that I have been very pleased, more than pleased, with the work put out via the comms department with Daisy, with the LFTs, all of that. Working with my team in waste, it has been a pleasure. And I just wanted you to realise my little Daisy has done well. If she comes on to me most mornings, and she's a good girl. You've got a good girl working. Okay.
Brilliant. Thank you, Doc.
Thank you very much. Thanks, Doc.